Thank you. Today I want to give you a very brief update on where we are with the new treatments and with what we know about these treatments. As you know, there are 3 drugs available at the moment. One working with gene therapy and the other 2 with different mechanism. And these 3 drugs have different ways of delivery, intravenously, intrathecal, or oral, and all 3 have been approved worldwide. But before we understand how much this drug works, we have to understand what happened before the drug arrived. And this is what was known about type 1 SMA. We know that type 1 is the most severe form with onset in the first months. And before the arrival of treatment, only 8% of the children survived at 20 months. And most of the children died before the age of 20 months. And we were measuring their functional abilities. None of these children ever improved. They were all decreasing. These are some points on a functional scale, and you can see that they were all losing points, some very rapidly, some in a slower way, but none was improving, and very few were surviving. And these are the 3 studies that have shown for the first time that the 3 drugs were working in type 1 spinal muscular atrophy. And what is great to see that we were used to see only 8% of survival, and now with all these 3 drugs, we see a survival which is very close to 100%. It's very often well above 90% with all the 3 drugs. But not only we can make these children live longer, but while in the past we were used to see all these lines going down, that means that the children were losing function. Now we see some improvements with all the 3 drugs that are better seen in the one in red here, that are the children who were treated very early. But some improvement can be seen also in the other ones. And sorry, this is going a bit faster. So these were results from clinical trials. And the challenge was to see whether once the drugs were available in the real world with no inclusion criteria and with no selected population, we still saw some results. And these are our own results from 4-year follow-up with the first drug available. Apologies, this is going without my permission. These are the results of the 4-year follow-up, and we can see that all the children who were treated at different age, of course, the one who were treated early had the best immediate response, but all showed some improvement, and this improvement is maintained over time, even for 4 years. So here we see again that the children in red who are treated early have the best immediate results, and also the others show some improvement, and all survive and remain at least stable over 4 years, which is a great result for children who did not survive and were always deteriorating. And the magnitude of the response is better in the children who are treated as early as possible, and in the children who are well at when they are starting. These are children starting without any respiratory or bulbar function, and this one had some bulbar function, and you can see that these ones are doing slightly better, but these ones are also improving. So even if we treat these children when they have some problems, we can still see some improvements, which are less than here, but still very long duration and nice improvements. And again, these are our 4-year follow-up data between children who had 2 SMN2 copies in blue and 3 SMN2 copies. And you can see that both show some results. Even if the one with 2 copies started from a lower level, they still show an improvement, which is very nice. Actually, the improvement is very parallel to the 3 copies. So what are the treatment expectations now? We know that with the 3 drugs, we can have increased survival. There are very, very few children who do not survive because they are extremely severe or because they do not follow standards of care. And there are some factors like lower age, children treated very early, and with little disease severity at baseline that are related to more improvement in motor function. Now I move to type 2 and then type 3 SMA. And these are the results of the two studies. We know that gene therapy for the time being is not available in the older children. So these are the results from nusinersen and risdiplam. And in both the clinical trials, you can see that there is an improvement over time. And this improvement compared to the placebo was estimated around 4 points on the Hammersmith scale. And here you can see the results on the MFM. And it's nice to see that both studies show an improvement. But again, the question is, what happens when we use these drugs in the real life? Because in clinical trials, because they are proof of concept, they are very selected population. So these are the results of a large study, including Italy, UK, and US patients in type 2 patients. And you can see that the improvement here is slightly lower than the one observed in the study. So if you look at the results like this, we don't understand why these results are slightly, less optimistic than the other ones. But we can better understand this data when we compare to the natural history. And we know that in the trials, we were mainly including very young children, while in real life, we have children and young adults of all ages. And this is what happens if the children are untreated. Before the treatments, we saw that before the age of 5 and between the age of 5 and 13, there was a very rapid decline. So these children were losing very rapidly points, which means they were losing a lot of functions. So they were losing the ability to roll and to do other important things for everyday life. And this is what happens when we compare the results of our treated children in green with our natural history, with the untreated children. You can see that in the overall population, we see an improvement in the first year and some further improvement in the second year. But look what happens in the untreated patients. They lose they have some decline in the first year, but they lose much more in the second year. So if you compare what happens in after 2 years in the treated children who keep improving and the untreated children who keep deteriorating, you see that the difference between this and this becomes much better with increasing years. These are the very young children, and we see that the untreated children are overall stable. At 2 years they lose something, and see how well they respond at 1 and 2 years in the untreated. But the amazing group is this one, because it is true that these children after 2 years of treatment are stable. They show minimal changes. But if we had not treated these children, we would have seen a loss of many points. And so you have to look at these results that in this age range, stability is a great success. Stability is a great achievement, because if we were not treating these children, they would lose a lot of activities. And this is true both on the Hammersmith scale and on the scale for upper limbs. You see again here, minimal improvement with treatment, but much of a loss if treatment had not been given. And these results that we found in type 2 have also been confirmed in the type 3 SMA. We see a similar pattern with some improvement in the treated children and a lot of deterioration in the others. And I'm very happy to show you details, but I know I don't have too much time. And these are the results with the other drug, with risdiplam. There are now some results that have been obtained of 3 years, and you can see that after 3 years, there is a stability, which is very important on all measures that are important, because these are children with a much larger age range and they would deteriorate. So all these results show that these drugs provide some stability and often some improvement, but we don't have to forget the stability is very good, because without drugs, our children, our young people were losing a lot of points. So why do we need this finding? Because all 3 new therapies have proved to be efficacious, and families have to understand that depending on the time when they choose treatment, when they start treatment, their expectations are different. Of course, parents of a younger child with type 2 may expect more improvement, while patients who are already between 5 and 12 should hope for stabilization, which would be already a great result. And this is important that we understand this, but especially that regulators understand this, because if regulators expect us to see always an improvement, this is not possible in children who would lose 6 or 8 points, and the drug can help to remain stable. And we have to understand as families, as doctors, as politicians, regulators, that for some clinical groups, stability is an extremely important achievement. And just one final slide to remind you that while we are very committed to treat the children who already have the disease, the very challenge is to try to identify the children as soon as possible with neonatal screening, because if we treat them before the onset of symptoms, we see a lot of difference. This line red and black are the treated children after they had symptoms, and these are the ones who were treated before the onset of symptoms, and you can see how much more they can achieve. So these drugs, all the 3 drugs, have proved also to be efficacious in the pre-symptomatic children, and it's extremely important that while we are committed to our children and adults who are already with the disease, we try to cure the children as soon as possible. And I think this is my final slide. Thank you.